Imagine going for a fun trip and you end up like this. Oh my god. Or a magic show where you were sliced. Or you're just an ill-fated fellow. You could just lose your limbs and thumbs anywhere, anytime. But will you mourn forever? Definitely not. The globe is now futuristically advanced, having innovated n number of devices beyond a commoner's comprehend, not just in terms of aircrafts and weapons, but also in medical and lives. Death defeaters, cloning, DNA customization, organ transplants, and whatnot. But what if we could actually create the lost limbs or engineer our tissues and cells to enhance their functions?
Regenerative medication manages the method involved in replacing, designing, or recovering the human or the creature cells, tissues, or organ to re-establish or lay out typical capability. In simpler terms, it's the process of replacing, engineering, or regenerating the human or the animal cells, tissues, or organs to restore or establish normal function. This field holds the commitment of designing harmed tissues or organs by reviving the body's own maintenance system to recover the forehand tissues or organs practically. Regenerative medication additionally remembers the chance of developing the tissues or organs for the research center and embedding them when the body can't recover itself. At the point when the cell's hotspot for a recovered organ is gotten from the patient's own tissue or cell, the test of the organ relocate through the immunological jumble is escaped. Inside the field of regenerative medication might include the utilization of underdeveloped cells. Models incorporate the infusion of foundational microorganisms or cells got through the coordinated separation. The enlistment of the recovery by naturally dynamic particles regulated alone or as a discharge by a cell, and the transplantation of vitro developed organs and tissue designing. Regenerative medicine is not just the future hope, it is the reality today. Cell-based therapies and products are on the market now, and many more are in the advanced stage of being tested in patients. These products provide insight into what the future holds in terms of patient health and economic impact.
Types of therapies. Stem cell treatment is a type of regenerative therapy that uses a special type of cell to repair injuries. Stem cell therapy is used to treat back pain and help regenerate tissues in the spinal discs. These cells are collected from the patient's own fat, blood, or bone marrow. They are then put into a medical machine called a centrifuge so the doctor can identify and separate the cells to find the right ones to use for the regenerative therapy treatment. The cells are then injected into the part of the body that needs to be repaired. Second, cartilage regeneration. One type of regenerative therapy that can help people with musculoskeletal condition is cartilage regeneration. This therapy is aimed at healing damaged cartilage. A surgeon can encourage new cartilage growth by making small cuts or abrasions in the bone underneath the injured cartilage. The hope is that the blood from the damaged bone will facilitate new cartilage cell growth. Prolotherapy. Prolotherapy is a type of regenerative therapy that treats injured joints and connective tissues. It is often used to treat arthritis, whiplash, and degenerative disc disease. It can be used on the back, neck, shoulder, hip, hands, and knees. In prolotherapy, a doctor injects a watery solution containing substances like saline and dextrose into the injured area.
Pros and cons of regenerative medicine. The field of regenerative medicine continues to grow by leaps and bounds, with each new study revealing remarkable benefits and potential uses for stem cells and platelet-rich plasma, which is also known as PRP. At the Regenerative Institute of Newport Beach, we specialize in regenerative medicine, so we take a deep dive into all the available information and use it to provide effective pain-relieving treatments to patients with a diverse range of health problems. There are top 5 benefits of regenerative medicine. First one, Stem cells. Your body has a variety of adult stem cells that continuously replicate, creating a new cell that can develop into one of many possible cells, each with a unique function. For example, as regenerative tissues such as collagen, tendons, ligaments, cartilage, muscle, and bones. Second, platelets. Platelets are a natural component of your blood. When you suffer an injury or develop a disease, platelets go to the damaged tissues and release a variety of growth factors to trigger healing. Fourth, relieve chronic pain. Regenerative treatments build new tissues, reduce inflammation, and help prevent scar tissue from forming. Working together, these actions do such a good job of relieving pain that stem cells and platelets in the form of PRP may be used solely to treat your pain. Regenerative therapies are especially beneficial for alleviating pain caused by soft tissue injuries such as strained muscles, sprained ligaments, and torn tendons. PRP is used to reduce chronic back pain. Age. Although your platelets and stem cells keep working throughout your lifetime, their response slows down as you get older. As a result, you don't heal as quickly. Fifth, severe injury. If you have a severe extensive injury, your body's regenerative abilities may be overwhelmed, making healing stronger than normal. Cons of regenerative medicine. Adult stem cells are hard to grow for long period in culture. There is still no technology available to generate adult stem cells in large quantities. Embryonic stem cells may not be accepted when used in transplants. Pluripotent stem cells usually have no certain method of maintenance and reproducibility. There is limited ability of the adult stem cells to grow in culture for long. Stimulated pluripotent cells normally do not have any method of maintenance and reproducibility. The embryonic stem cells remain in controversy because the cells are taken from human embryos. Usually there is a very small number of adult stem cells in each tissue, making them difficult to find and purify. Embryonic stem cells may become a cause for tumors if they are used straight from undistinguished culture prep. The long-term side effects of the therapy are still unknown. If the cells used in the therapy are embryonic, then the disadvantage is that the cells will not be from the same human body and there are chances of rejection.
The ethics of regenerative medicines, destructions of the embryos. One question about the ethics of regenerative medicines has preoccupied most of the public debate for many years. Whether the moral status of the embryo and fetus makes use of human embryonic stem cells ethically problematic. The fundamental question is whether it is morally acceptable to pursue novel therapies for curing illnesses at the expenses of destroying an early human embryo. This debate brings out individual opinions so deeply rooted in basic moral beliefs that developing a definitive policy acceptable to everyone seems unlikely. Compensation. One of the common ethical issues in regenerative medicines is progress in compensation of the human body and the enhancement of the view of such human body parts. Follows the steps of materialization, being treated as a material object, resocialization, being treated as a resource, compensation, being treated as part. Moral status of the human embryo have raised questions about the sources of embryonic stem cell lines, leading to both ethical and public policy debate. When embryos must be destroyed in order to create new cell lines, moral and religious concerns are raised. Safety issues. Embryonic stem cells are highly versatile, able to give rise to all types of cells and to be immortalized or perpetually propagated in a cell line. Their versatility makes them valuable for research and treatment. However, they also have the intrinsic property of forming teratoma tumors, risks in the near future. We describe ethical challenges, emphasizing that ethical dilemma involving the destructions of a human embryo is a major factor. Unlimited differentiation potential of iPSCs, which can be used in human reproductive cloning as a risk for generation of genetically engineered human embryos and human animal chimera, is a major ethical issue.
Jeannie's case study, stem cell therapies helps patients with chronic low back pain. Janie has a history of degenerative disc disease. She has tried many different therapies for 15 years to relieve her pain. She got to the point where life just wasn't worth living anymore because she could no longer do the many things. That was when Catherine at a regenerative Orthopedic Institute talked to Jeannie about stem cell therapy. Dr. Grana treated Jeannie with a procedure called stem cell therapy, a non surgical alternative for the treatment of a variety of musculoskeletal conditions using the patient's own cells. Using a small needle, stem cells are collected by aspirating the bone marrow from the back of the patient's pelvis or by collecting fat cells from the abdomen. Local anesthesia was used for minimal discomfort. The aspirate is then placed in a centrifuge which spins it at a high speed to separate the stem cells from the rest of the bone marrow aspirate. The concentration of stem cells, called bone marrow aspiration concentrate BMAC, was then injected close to the injured diseased tissue using ultrasound or X-ray guidance. Because Dr. Grana is using the patient's own cell, there is no possibility of the body rejecting the new tissue formed by the stem cell procedure, making the procedure both very safe and very effective. This treatment allows the body to take advantage of the normal healing pathways at a greatly accelerated rate. Jeannie came in for a post-treatment interview and said it was relatively easy. When asked how she was doing now, Jeannie said, "What a difference. I had to stop playing the sports I enjoyed, and now I'm doing all that with absolutely no pain. It is fantastic."
Rapidly advancing medical knowledge is leading to the development of powerful new gene-based therapies that will transform medical practices, allowing most people to live much longer and healthier lives. They are the cells that steer our development and maintain and repair our bodies. They can stimulate the growth of aging tissues. Human substances are now in testing for boosting the immune system, strengthening bones, repairing cartilage, and a variety of other purposes. As RM advances, we will learn how to restore an ever-widening range of worn-out organs and tissues. It has been speculated that more refined implants could, in time, enhance our mental capacities. In the meantime, however, advances in atomic scale and engineering will accelerate type 2 and 3 and regenerative medicines. RM may become the most powerful tool available to improve the human condition. Science has shown it can achieve the goal of using the body's own substances and cells to repair, restore, and rejuvenate. This new form of medicine does not take over the function of an organ completely through, say, growing a new one or installing partially robotic parts. Treatments regenerate and restore the health of the musculoskeletal system. Many notable athletes have healed their injuries through stem cells and other regenerative treatments, including Peyton Manning, Bartolo Colon, Kobe Bryant, and Andrew Bynum. Regenerative medicine is currently the fastest growing technology in orthopedics. Both patients and physicians are excited about these new expanded treatment options.